Hi, my name is Nada Shamimati Ismail. I am year 2 of student medical imaging. My number is 082112.
Welcome back, guys. Another day, another image analysis. So today I'm going to do a Paceman on abdominal pelvis, which is supine abdominal. Positioning, the first one is sacrum, coccyx and symphysis pubis are not aligned, which is sacrum and coccyx shifted to the right of the symphysis pubic. The second one is left ischial spine demonstrate without pelvic brim superimposed. And the third one is left ilium is more wider than right ilium. The fourth one is obturator foramen does not uniform in size and shape, which is left obturator foramen is more narrower. Next is the patients rotate to the left side. And also the right side of the iliac crest is slightly higher than the left side, indicate the body is tilting. The last one is the laser trochanter is demonstrated medially, and femoral neck is foreshortened, indicates the patient's leg is external rotation. To correct this position, rotate the patient toward the right hip until the SIS are positioned at equal distance from table, and internally rotate the patient's leg until the feet are angle 50 to 20 degrees from the vertical and the femoral epicondyle are positioned parallel with the table baki. Alignment of the SJ tube and patient's body are not aligned because the center of collimation does not fall at central point, which is S4 and S5 due to position of the SJ tube slightly higher. Next is alignment of the SJ tube and IR is not aligned because the distance from edge of the filum to the edge of collimation for top and bottom, also left and right, are not equal. Next, the last one is alignment of the SJ tube and patient's body are not aligned because the center of collimation does not fall at the centering point, which is S4 and S5, due to the position of SJ tube is slightly higher. So to correct this position, move the SJ tube along with the IR slightly lower until the center rate is between the S4 and S5, and also rotate the patient to the right until the SJ beam is perpendicular to the MSP and to the midline of the cassette. For the collimation, 4 collimation borders are visualized. The collimation is correct on 4 sides because the ilia, symphysis pubis, ischial, acetabula, femoral neck and head, greater and lesser trochanter are included within the collimator field. So for the exposure, the MAS used is adequate. Within 20 to 30 MAS indicated by the bony trabecular pattern of thick structure, which is acetabulum, is clearly visualized. The bony trabecular pattern of the thin structure, which is the ilium, also visualized. Thus, the density of the regular graph is adequate. The image is not overexposed or underexposed. Next is the KVP. The KVP used is adequate within 80 to 85 KVP, indicated by the bony cortical outline, which is thick structure of acetabulum can be seen. Next, the bony cortical outline of the thin structure, which is the ilium, also can be seen. Next, thus, the contrast for this radiograph is adequate. For the marker, a right anatomical marker identifying at the right side of the patient is visualized on the radiograph without superimposed with the region of interest. For the aesthetic, the film size used is correct to include all the required structure within the collimated field. Next, there is no evidence of preventable artifact visualized of the image shown. And the last one is name. There's no patient's identification, including facility's name, patient's name, IC, and also the date acquired on the radiograph. It should be placed on top of the corner of the radiograph without superimpose of the anatomy region.